I was hesitant to get vaccinated because I believe that they created the vaccination fast. It was just too quick. And a lot of people was getting vaccinated and they still was catching COVID. And I was thinking about the baby. Like, it might harm the baby. So every time I went to go visit Dr. Drake, she, informed me more and more of why. And then I explained to her, I was like, okay, I had COVID March of 2020, and I thought that, you can't catch it no more. But she was like, no, it's been a year. You can catch it again, and, you gotta think about the baby.
We know that getting antibodies either through natural infection or vaccination does help decrease the severity potentially of an infection, but we don't know to what extent. And so, getting that kind of boost like we do for other vaccinations, like for influenza every year, helping build antibodies could help prevent someone from being hospitalized in the ICU. And, definitely our goal is to prevent people from dying from COVID. There is a lot of vaccine hesitancy with our patients, for sure. And that's something we do see, like Nea is saying, we see with the flu vaccine every year. So it is something we are used to, counseling patients about. My goal is that we protect our moms and our babies, and that especially at Rush, we have a pretty diverse population that are mothers of color, especially, that we want to protect them. And we know that there's been a huge disparity in how COVID-19 has affected our patients of color. And so that's one of the ways that I approach it, is to say, that we know that from large studies from CDC that the vaccines are safe, that one of our biggest things that we're trying to do is to protect our moms from getting very sick, and that we know that mothers that get COVID-19 can end up hospitalized in the ICU, that there's death associated with pregnant patients getting COVID-19 because your body can't fight off the virus as well as it can when you're not pregnant. You're helping to protect your baby. So there's good evidence that patients that have had COVID-19 build antibodies in their blood that can pass on to the baby. Additionally, new moms, so moms that are breastfeeding, if they have the vaccination and build antibodies, can even pass antibodies through the breast milk, and potentially that can help protect the newborn as well. So it's a conversation that we just continually have, and sometimes it is just a journey that we talk about, what information patients like Nea are coming in with, and what we can do to inform and help them get to a point where they feel comfortable with their health.
I trust her. I've had a doctor before this, and now I have Dr. Drake, and she's excellent. So the communication and the information that she provided me, it helped me come to my decision like 100%. Even though I was doing my research as well, but getting that knowledge about COVID-19 from somebody who knows about, Dr. Drake's a good doctor, so I trust her, point blank, period. Yeah. Since appearing in the Sun-Times regarding my vaccination for pregnant women, my feedback has been excellent. My mom's friend and her daughter is also, she's 6 months pregnant, and my mom said she called her while she was at work, the daughter, and was like, I saw Nea in the paper, and I read her article and the facts that she presented in the paper about getting vaccinated, and I think it's really good. I'm thinking I'm gonna go ahead and go and get vaccinated.
And Nea is like the ideal patient who comes in and she does have her questions, yes, and she's really engaged and thinking about herself and her baby. And so I think it was just discussions over time where we were able to build the trust and
yes.
and do what's best for her and for Chase.
Dr. Drake, thank you. Like, I'm serious. Like, I was really hesitant about getting this vaccination. Like, I put my foot down, because she asked me. She kept saying, get vaccinated. And the key points, you have to think about your health, and you was on the point. You was the key point to me getting vaccinated. So I appreciate that.